Let's take you now, our audiences, let's take you to a cardiologist, a very senior cardiologist who we're lucky to have with us here on the show. Dr. Vinod Sharma is with us this morning. He's the CEO of the National Heart Institute, and we'll dive deeper with him into this entire story. Dr. Sharma, thank you for joining us here on the show. Doctor, we just want to come to you first with this big question. As we told our audiences earlier, lots of studies that are saying that yes, a vegan diet can actually be better for you than an omnivorous diet in certain ways, particularly your heart health. What do you think of, doctor, when you see those studies? Most of them are actually conducted abroad. Are they as applicable to the Indian audience?
See, traditionally these three factors, diet, exercise and sleep, these are the three essential components for the healthy lifestyle and longevity. It is more pertinent as far as cardiovascular health is concerned. So when we compare these different dietary choices for best health outcome, whether it is veganism or non-veg dietary pattern or some of those people who are pesco-vegetarian, out of all vegetarian diet, veganism is associated with the best outcome as far as cardiovascular disease is concerned. If we see the risk factor for cardiovascular disease, whether it is the increased body mass index, whether it is diabetes, high blood pressure, high lipids, they are all linked with the non-vegetarian diet, meat-based diet. If we compare that with the vegetarian diet or veganism, there is a significant reduction in all these risk factors. They connect very favorably with the vegetarian diet. More so, there are a lot of factors which are there in the vegetarian diet that helps in decreasing the overall prevalence of coronary artery disease, which is the most prevalent problem as on today in all over the world. If we look at the pattern of the vegetarian diet and their so-called favorable effect, especially their effect on the inflammation, the coronary artery disease which is there, that is said to be due to inflammation of that atherosclerotic plaque, that cholesterol which has deposited in the blood vessel wall, that gets inflamed. So there are multiple views. I would like to quote two major landmark studies which are there. One is a community-based study, atherosclerotic research in community, and second is Adventist 2 study, and they have clearly come out with the conclusion that vegetarian diet is associated with significant reduction in cardiovascular disease to the tune of 24%. Other than inflammation, there are a lot of things which is associated with vegetarian diet, like there are increased polyphenols, there is increase in glutamic acid, there is increase in the arginine which are there in the vegetarian diet. They all have a favorable effect on the blood vessels and therefore they contribute to the reduction in cardiovascular events. What is just now Dr. Charu mentioned, when we are planning for vegetarian diet, obviously the planning is most important. If someone wants to have a transition from non-vegetarian to vegetarian, planning is most important because there are multiple studies which have shown that people who are going for absolutely vegetarian diet have deficiency of B12, have deficiency of calcium. The protein ratio is not that favorable in vegetarian diet. So a dietitian has to perfectly draw a plan so that these deficiencies are met out properly. And then only it can balance the benefit and risk of going into the vegetarian diet.
Doctor, can we ask you, so vegan is obviously in some ways a step ahead from vegetarian, right? Because you're cutting out further things when you're a vegan. Doctor, there are some arguments that suggest that going towards a vegan diet, especially as you get older, can be more beneficial. That the older you get, because that's when you are more culpable to a number of issues, that's really when you should be looking at making a switch. What do you think there?
See, the question, as you grow older and then it is beneficial. Just now we heard about the Harvard study. It was started quite at a young age, those identical twins. And in a society, as the people get educated, they know about the health behavior, and that's how they are turning from non-vegetarian to vegetarian. So health benefit, whether it is started at early age or late age, it is as good as that. Now, seeing the epidemiological shift in the occurrence of the coronary artery disease, more and more younger people are getting this disease. And obviously, that is related to their lifestyle. So, it is good to start this positive health behavior quite early in the age so as to prevent the disease at a later age.
Okay, and Doctor, we just have one more question for you. We want to just ask you if you can take our audiences to what you see every day. Are you seeing an increase at all in vegan patients that are coming in? Because we hear of it as a trend, but are you actually seeing that happen? Do you see vegans come in, not vegetarians, doctor, vegans who come in and say we've made this change, and do you actually see a health change in them?
See, well, it all depends upon individual social value, religious value, and also their educational status. What I have seen in the practice, we keep on advising them that there are a lot of young people who have a coronary artery disease at a young age, and especially coming from some particular sect of the society where they have a habit of consuming non-vegetarian diet. Looking to their coronary artery disease, they develop at a younger age. We keep on counseling them to shift toward the vegetarian diet. More often, it is the highly educated people who quickly accept this fact and they switch over. But those people who are in the so-called young generation, they find it very difficult to switch over immediately.
Right. The toughest part I just want to add for our audiences is sometimes when you're trying to be fit, you're told by your trainer, for example, that you have protein goals to meet, and it's just hard to meet those when you're just sticking, for example, to chickpeas or protein supplements. Non-vegetarian does make it easier. So, Doctor, thank you for joining us. Thank you for bringing us your perspective. We'd also like to thank Dr. Dua, who joined us a little earlier. We hope you feel like this has given you a bit of a prepper, A, on how you can go about creating a vegan lifestyle if that is something you're interested in, and B, what the truth is when it comes to the cardiovascular picture. Is it actually better for your cardiovascular health? It seems, according to the doctor, that yes, it may be. Let's